Hello, everyone. Welcome to join us in today's online symposium jointly organized by two projects from two universities. So this is organized by the Tip Card Project, Tools to Inform Policy Chinese Community Session in Response to Dementia, and also STRIDE, Strengthening Responses to Dementia in Developing Countries. So I'm Gloria Wong, Assistant Professor in the Hong Kong U Department of Social Work and Social Administration. And we're very happy. So today, as everyone knows, today is the World Alzheimer's Day. And we're very happy to be hosting this online symposium. The topic is about how can we achieve a dementia-friendly society in 10 years. Now, although dementia-friendly community is not a new concept, but I think today we are trying to move the topic a little bit forward because we're not asking whether we can or whether we should, but we are asking how can we achieve such a society. And we have very specific timeline. We're hoping to see changes, real world changes in a decade's time. So I think we have a very wonderful program lined up, and to start our discussion without further ado, I'd like to invite our first our distinguished guest to open the symposium. So I would like to invite Dr. Lam Ching Choi, who is currently chairman of the Hong Kong government's Elderly Commission. But apart from that, Dr. Lam actually, for those of you from Hong Kong, I think Dr. Lam needs no introduction because of his extensive work in the elderly aged care field. But for our overseas guests, Dr. Lam is also currently the Chief Executive Officer of a major local NGO, the Haven of Hope Christian Service, and also the Elderly Care Service Industry Training Advisory Committee member, and a lot of other, so Dr. Lam wears a lot of different hats, but I think today, Dr. Lam's role in the Elderly Commission would make him the perfect person to start our symposium. So may I pass the floor to Dr. Lam, please?
Thank you very much, Gloria. Dear friends of dementia, both in Hong Kong and all over the world. And today, as Gloria just mentioned, is the World Alzheimer Day. And so please remember people with dementia, especially in the time of COVID-19, who are more vulnerable and with a higher mortality rate. And they can't receive various community care right now. And also, I believe many of them are separated from the family members just because of this epidemic. So facing with aging population, our government has been taking a more active role in dealing with dementia in Hong Kong. I would say the challenge is huge, not to mention the coming dramatic increase just by the volume of people suffering from dementia. In recent years, there are many dementia awareness programs launched in Hong Kong to change people's misconception about dementia and tackle the stigma towards people living with dementia. For example, the 3-year Dementia-Friendly Community campaign initiated by our Social Welfare Department just around 2 years ago. And that aimed at advocating public awareness of dementia and building a dementia-friendly community. Series of public education and publicity programs were conducted under the campaign. And I just mentioned one of them, which is quite special. 8-episode television docudrama. In Chinese, we call it 歲月不忘情, which are very well received. And so there are 8 very touching stories about people suffering from dementia and their family members. The campaign also appeals to the public to sign up as dementia friends and encourage them to watch out for signs of dementia among seniors in their neighborhood. There are also enterprises and organizations of public services answers the call to register as a dementia-friendly organization. And a lot of those are trained dementia friends, which are over 15,000 people already, are frontline postmen, policemen, bus drivers, and supermarket staff, and bank tellers, etc., etc. So all these people will look out for people with dementia for us in the community. I would like to speak specifically on the urban design. Building a dementia-friendly community is not just providing service. We need to have a very good supporting system of neighbors. And we should have our urban planning especially designed for our overarching principle in elderly care in Hong Kong, which is aging in place. And not just elderly prefer to live in a familiar environment, but especially so for the people with dementia. And research finds out there are 6 major requirements for outdoor environments to be dementia friendly. They need to be familiar, legible, distinctive, accessible, comfortable, and safe. The public estate built by the government do generally adopt these elements. And to me, the major concerns in Hong Kong are the private developments and those old estates with old buildings. In Hong Kong, we especially suffering from what we call is a double aging. That means we not only having aging population, but a lot of these aged people are living in aged buildings. And so while we are doing urban renewal, we should be reminded of the elements which I just mentioned. And lastly, I would like to mention a bit of geron technology. Since aging in place as the core, institutional care as the backup was being adopted by the Elderly Commission and the whole government on our elderly service. And geron technology is seen as a strategy to assist caretakers and relieve their physical burden, as well as improving the efficiency for the elderly care services. The government has been actively promoting the use of technology in the aged care sectors. It launched a 1 billion Innovation and Technology Fund for application in elderly and rehab care in Hong Kong. And for this fund, we're going to subsidize eligible elderly and rehab service to procure technology products and also to improve the quality of care. I look forward to many more geron technology applications in the future, which will greatly help to improve the quality of life of dementia patients, the carers, and the service provider. When we're talking about the massive number of coming dementia patients or individuals with dementia, technology to me may be the only single application that can have an exponential capacity to catch up with the volume. So that's why I mentioned technology as my last remark. And I look forward to the later presentation by the experts and the coming discussion. The government has the responsibility to map out the policies for Hong Kong. But the main bulk of burden, I would say, is on our families, our informal carers, the service providers, and the society at large. So I expect our discussion will help to trigger the discussion of policies among the government and also with the society together. Thank you very much.
Thank you very much, Dr. Lam. Talking about technology, actually, this is the first time that we host a symposium through Zoom. So I think there are a lot of things that we need to learn together. And one thing so a little bit of housekeeping for this symposium. So as I mentioned, we have a very wonderful program lined up, and we will have some time for discussion towards the end when we have our panel member and speakers discussing about how do we co-design a blueprint on dementia care for the next decade. And throughout the program, if you have any questions that you want to direct to any of our speakers, you may feel free to type into the Q&A or the chat box, and we'll help watch out the questions and direct them to the right speaker. So with that, I would like to invite our first speaker of today, Professor Martin Knapp. So Professor Martin Knapp is currently Professor of Health and Social Care of the Care Policy and Evaluation Center of the London School of Economics and Political Science, and as well as Director of the School for Social Care Research of the UK National Institute of Health Research, as well as being the principal investigator of the STRIDE project and the co-principal investigator of our TIPCARD project. With that, I would like to pass the time to Martin to share with us about strengthening responses to dementia experience from UK and lower and middle income countries. Thank you, Martin.
Thank you, Gloria. Is my screen sharing at the moment?
Yes, perfect.
It is. Okay, good. Okay. So thank you very much indeed for inviting me to participate, and good morning from here from England. Trying to get my, here we go. Okay, good. So what I'm going to say is a bit about what we're doing in the STRIDE project that Gloria mentioned earlier, and what that might imply for making societies, policies, systems, and so on more supportive of people with dementia. So this is a photo I took yesterday morning, just not very far from where I live. These are beautiful English apples, scrumptious apples. And I'm going to use this in my presentation, and I've got an assistant. This is my assistant, this is Thea, age 2, who was helping me to check the quality of the apples yesterday. And why have I put her there? Well, I did a bit of research and I checked on her life expectancy. A girl of age 2 in the UK today can expect to live until age 91. That's her life expectancy on average. If she lives to 91, there'll be another 89 harvests, apple harvests that she will see, and she has a 25% chance of having dementia by the time she gets there. And if she lives to 102, there's a 1 in 10 chance of that, then there's a 37% likelihood she will have dementia. So the issue we're facing today is that what we all know, the dementia prevalence rate increases very steeply with age, that as you get older, the chances of dementia are much greater. And linked to that, we have these rapidly aging populations. So here is a slide, quite a complicated slide, which shows what we expect to happen over the next 40 years or so in terms of the population aged over 65, and it's older people who are much more at risk of dementia, various forms of dementia. So I put on there the UK and China, and what we can see is China having a much more rapidly aging population than the UK, but all countries in that slide, all countries in the world having this rapidly aging population. So what we're going to see then is soon many more Thias, and I'm not going to try and pronounce that in Cantonese or Mandarin, but many more people who will be facing the challenge of aging, and particularly the challenge of dementia as they get older. So in the research we've been doing in the UK and internationally, we're interested in how societies can respond to that current challenge and future challenge. So here's a slide from a project that we more or less finished. I think research projects never quite finish, but this is a research project called MODEM, which looks at England. Lots and lots of elements to it. This is one of the elements. What we did was build a very complicated projection model how many people do we expect there to be with dementia and a whole range of other conditions over a 25-year period into the future? And then what support would they need and how can we improve the support they get? And what this slide shows you is the total cost that we would expect to see in 2040 if we don't change our health and care systems. So we keep our systems exactly the same as they are today, but we then just sort of apply them, if you like, to an aging population. And what you can see is that the costs of supporting people with dementia, if we don't change the system, will increase by precisely 249%. And the components there, healthcare, social care, and unpaid care, you can see substantial increases. Unpaid care, that's the support that individuals living with dementia will get from their spouses, from their children, from other family members, from their friends, and so on. So these are substantial increases that we are facing in England. My guess is that the growth is going to be much faster in Hong Kong, in China, in many other parts of the world, in the increase in costs. And so this is a challenge. And the question then is, how do we, or how can societies respond? And what the research literature will say, and what the policy discussion will say, is there are broadly three responses that we can think about. We can find a cure, a disease-modifying treatment, which, if it's applied to people early enough, will stop dementia, some of the dementias emerging. So that's one possibility. Second is prevention. We know now that slide, that little complicated snake-like picture comes from the Lancet Commission on Dementia, the most recent version published about 3 months ago. And what that group of people calculate is that maybe 40% of dementia could be prevented by various actions in early and midlife. And then the third option is better care and support. Now, we're not very close to finding a cure. Some people in the pharmaceutical industry might want to disagree, but I think we're a little distance from finding a cure. And even when we find it, making it affordable across the world is going to be a bit of a challenge. Prevention, we have much better idea of what's going on, but we'll have to wait for that to have an impact. So then the third one, the better care and support, that's what we're focusing upon in much of our research at the moment. And the STRIDE project, which I'm going to describe now, is focusing particularly on that care and support angle. So what is STRIDE? STRIDE is a project funded by the UKRI, that's the research councils in the UK. It's funded over a 4-year period, and we're working in 7 countries. Those are the countries shaded in red. A bit of my slide is hidden by images of people, so I can't be sure that you can see all the countries, but they're there, 7 countries there. And in addition, we've got some other countries and territories and areas which have joined, and I think I've marked tip card on the slide there. Hong Kong is an important part of our project, in our sort of wider project. So what are we doing in STRIDE? We're looking to build capacity in generating and using research evidence to support policies, to improve dementia care, to improve treatment, to improve the support of people with dementia and their families, with the aim of helping them to live better lives. And that means looking at how we can develop the systems, how we can fund them, how we can scale up evidence-based interventions, and so on. And we're leading this at LSE, and there are various other partners that are working with us. So where does STRIDE come from? These projects don't just come out of thin air, they're built on many other things. And this is a very complicated slide, which I'm not going to talk about. And I'm sure Gloria and colleagues will make the slides available after the event anyway. But the project built on things we'd done in the UK. There's some work over here we did before. It built on the MODEM project. It built on some very good work by colleagues across the world, looking at mental health in adults rather than dementia in older people. But built on a number of other things. And what are the components of STRIDE? So I put the main components here, and these are the things I think that the research community can offer to help countries, to help societies, to help communities make for dementia-friendly contexts and environments. So what are we doing? We're doing a situational analysis, which is basically describing what is dementia care and policy today in each of those different countries and territories and so on. We have a theory of change, and I'll show you a little picture in a moment of that. I know you've had one recently in Hong Kong for the Tip Card project. So theory of change is getting people together, a whole range of stakeholders, asking them what needs to change and how can it change. We've been looking at the current cost of dementia, that's number 3. We've been looking, number 4, at the future scenario, the future costs, the future workforce requirements, the future financing needs. To sort of give a platform for some of that, we, in number 5, have this big systematic review of dementia interventions, particularly focusing on lower middle income countries. That is proving to be an enormous task because there's much more evidence than we thought, particularly in the Chinese literature. So thank you again to my colleagues in Hong Kong for their considerable contributions there. Number 6 is a stakeholder and impact analysis, working with a whole range of stakeholders in the state sector, in the NGO sector, in communities, in universities, and so on, to try to understand what is dementia, what does dementia mean in these different societies, and how can we improve the circumstances for individuals. And then we've got 3 empirical pieces of work which are being very heavily conducted, if you like, very, very big pieces of work in our 7 countries, but in each country has one of those. So number 7, we have these big household surveys of the prevalence, how many people are there living with dementia, what are the services they use, what are the impacts, because those countries do not have those sort of data. Number 8 is focusing particularly on awareness and stigma, which I'm sure we're going to hear more about today's webinar. And number 9 is focusing particularly on unpaid care, on family and other people who provide unpaid care for people living with dementia. So those are the research components for STRIDE. Here's the theory of change. These are pictures of our theory of change workshops, not all the participants, but you can see, well, you can't see, but you can see lots of people, that's all you can see. But these people, they don't wear badges that you can read, but they come from different sectors. They come from the NGO sector, from the government sector, from the health provider sector. They include people living with dementia, they include carers, they include researchers, a whole range of different interests and areas of expertise and experience brought together. And you can see, you know, they have lots of fun with post-its and various other things, trying to work out what needs to change in relation to dementia care and policy in their individual countries, and how can that change be achieved. And bringing these people together, I think, is a really key part of making for dementia-friendly communities. So this then is a sort of schematic map of what we're doing in relation to STRIDE and policy development. I won't go through the details there, but the elements at the right-hand side, we're trying to get this much better policy development, but we're trying to do it by bringing together better evidence on the cost of dementia, better evidence on what care pathways there are and what could be improved, looking at evidence from other countries and how that might feed into local discussions, etc. Doing all these things, I think this is where researchers can contribute to the better shaping of policy and practice for people with dementia. So 2 more slides for me. The first one, I picked this up on Google this morning. What is the definition of friendly? Which might be in a dementia-friendly society. And I've just picked out some of the words in that online dictionary. Affectionate, warm, hospitable, neighbourly, sympathetic, open, kindly, beneficial, helpful, favourable, non-hostile. Those are all things we want from our policies, from our communities, from our services, when we think about people living with dementia and their families. Those are not easily achieved. And I think this is where, in order to help communities and government policies and systems, etc., to be friendly in that very broad interpretation, this is where I think evidence can help, and I hope the STRIDE project is going to contribute. So then finally, here's my research assistant again, Thea, that was taken yesterday morning, having a bad hair day, I think. But you'll see in her left hand, she's holding a watering can, and that wasn't placed there. I think she's there to sort of encourage apple harvest to continue into the future. And to the side of her, that's her great granny, who just by chance is 91 years old, which is the life expectancy for Thea, and that's one of Thea's sisters and cousins. And I think that's my mother as well, by the way, is completely cognitively intact. She has no sign of dementia at all, but we would assume 25% of people in her generation have got dementia today. And that's a huge challenge for all of our societies. So thank you very much again for the opportunity to present. Thea can't be here to join me in the presentation live because she's busy at nursery, but I look forward to hearing the rest of the presentations. Thank you very much.
Thank you very much, Martin. Well, I'm sure that Thea will be friendly towards us as we grow old. In view of the time, I will put the question and Q&A part towards the end. So let me move on to invite our next speaker, Professor Wong, who I'm sure will be able to share with us some very exciting development of dementia service and policy in China. So Professor Wong is professor at the Institute of Mental Health of Peking University. She's also the executive vice president of the Alzheimer's Disease China, as well as a member of the National Clinical Research Center for Mental Disorders. So I will now stop sharing my screen and over to you, Huali.
Thank you, Gloria. So I'm going to share my slide. Yeah. Hi, good afternoon. It's my great pleasure to be here, and thanks to Gloria for your invitation to join this symposium. Today, I'm going to briefly introduce what we have done to promote dementia care service and policy in China. So my talk will be split into 4 parts. First, I would like to introduce what's the concept of continuity of dementia care in our culture, and how we promote community-based and residential care facilities dementia care. And lastly, I will update some of the policy relevant to dementia care in our country. As Martin just mentioned, that dementia has been a global public health priority, and there are more and more people living with dementia in the worldwide. And in China, it was estimated that there are more than 10 million people living with dementia. So that's a huge burden in our society. But unfortunately, there is a huge gap of diagnosis and treatment in our society, because people have very low literacy of dementia. We can see that they have quite a lot of knowledge of dementia, but they have their attitude and their behavior to seek support was not so optimal. So that's why we still consider that people have lower literacy. And also, a couple of years ago, we conducted a survey, and we found that in memory clinics in big cities of China, more than 2/3 of people having dementia, they only went to hospitals to seek medical diagnosis in like more than 1 year after they noticed the first symptom. We can see that usually the family members notice symptom at like not very early stage, usually in moderate stage. So it seems that people have been delayed in seeking medical care. So that's why we have to try to find some solutions to improve timely diagnosis and also optimal treatment. So in the past years, we have summarized different approaches in our practice, and eventually we summarize them into a whole of society approach. That means for people living with dementia, we have to maintain their function, because currently we cannot cure their cognitive impairment, but we have to maintain their function, try to reduce the functional limitation. But for the family, we have to provide substantial support. And how to provide substantial support for the families, we consider that if we could maximize the function of communities, that the families could be supported and sustained in the community, and people can live at home for a longer duration. And then in order to maximize the function of communities, definitely all the stakeholders in the society have to collaborate with each other. So in the past years, we have tried a lot to try to encourage the collaboration between different stakeholders. And if we put this service on the individuals of people living with dementia, we can find that actually the dementia care can be inclusive in these 4 aspects, including medical diagnosis, post-diagnostic support, and care support for people who have been diagnosed with dementia. But for those who have higher risk of developing dementia, we have to improve the risk assessment and trying to support them in very early stage. So last year we published this concept and also the challenges of providing continuum of dementia care on the Journal of Global Health. So more details, you can find more details from this article. And from the practice of our center, we have spent nearly 2 decades to develop a series of dementia care and services for people living with dementia. In the year of 2000, we established the first caregiver support in China. So now our caregiver support has been lasted for 20 years. In July, we celebrated our 20th anniversary, and we delivered a 1-week-long public education online. So it was well received. But after we established this service, support service, we realized that we have to do a lot of studies to understand the perception of dementia and their caregiving experiences. So we spent a couple of years to understand the caregiving from the persons living with dementia and their carers' perspective. And then we realized that most of them live at home, so they have to be supported in the community to try to reduce their burden of transportation, to seek support from medical facilities. So we developed the community-based Bring Health promotion program and then implement that in the communities. First, we transfer our caregiver support group into the communities, and then we developed the whole community-based care program. I'm going to give more details later. And then last year, we started to extend our support for the residential care. And so in the next few minutes, I'm going to introduce our community-based program and our residential care program. Regarding our community program, we give a title as Healthy Memory in Community. That will make the service to be more friendly, to be well received by the residents. From the year 2015 to 2018, we implemented this program in the community. What our program included? Actually, the program includes 4 major parts. One is to improve community training, not only for community health doctors, but also for social workers working in the community. We also provide public health education to raise awareness in the communities. And then we support the community health doctors to perform cognitive screening for the elderly in the community. And then we collaborate with them to support and provide different care for people who have different level of cognitive impairment. So in this program, the specialists collaborate with community services. We have different responsibilities. For example, in the community health workers, they are responsible for deliver health education program and also to do cognitive screening. And for the specialists, we have to provide a comprehensive assessment and examination for people who are suspected of dementia. And then we support them to make diagnosis, to develop the individualized care plan, and then refer them back to the community health centers to support. And the specialists support community health centers to provide care support and also to do follow-up visits. So currently we have established community memory clinics in 4 communities. So that can help us to enhance the collaboration between the specialist care and the community doctors. Here I just demonstrated what the activities look like. For example, the left column, that's the training session for community health workers. So after the training, their knowledge and skills have been improved dramatically, they could have quite a high rate of corrected answers. And also we found that after training, they can the screening rate of cognitive impairment have been improved dramatically, because before our training, they never did any cognitive screening. But after training, the rate of screening during their routine practice has been improved up to 30%. So that is a huge progress. And in the middle column, that's the event we delivered education. So we delivered brochures, we delivered courses, and also we tried to organize the panel discussion about how we can promote, how we can educate the local residents. And we found that after the public educations, the old adults could understand dementia more clearly than before. Their answers to some questions could be more, they have more correct answers than before. And also about 60% of people would be willing to be screened. They do not feel ashamed of being screened. And concerning for the stepped care, actually people have different level of cognitive impairment. Especially in the community, we provide cognitive training for people who have mild cognitive impairment. Because currently there's no medications indicated for MCI, so we try to provide non-pharmacological interventions for those people. But for people who have been diagnosed with dementia, we provide medications and non-pharmacological intervention together, and also we support family members. And also we encourage the social workers to provide support. For example, the social workers could conduct cognitive interventions for the elderly. And also currently there are more and more community centers. They could build the rehabilitation center in the communities. So those rehabilitation center is small scale. They can provide support for about like 20 to 30 people living in the community. So like they do cognitive training, they do art therapy, they do motor exercise for the elderly. All those activities were well received by the elderly. And I could find that they have very positive response. For example, they feel like they were more active than before. So all these activities have been well accepted. And also, as I mentioned, that we have transferred some of our caregiver support to the communities. So the family members do not need to travel to the hospitals. They can just receive support in their neighborhood. So this is also a very good progress in the past years. And now in China, there have been more than 200 memory clinics. And we try to encourage these memory clinics to be built into a memory clinic network so that they can build collaboration and a liaison with the community health centers. Now more and more such kind of collaboration network have been established in different provinces, for example, like Zhejiang province, Tianjin city. So we could find that this is a very good format that people consider is convenient. It might be more feasible. And in the next few minutes, I will introduce what we have provided support for the residential dementia care. Actually, in the residential dementia care, we try to promote person-centered care. A couple of years ago, we validated the instrument named as the International Dementia Alliance Schedule for the assessment and staging of care. It was briefly named as Ideal Schedule. The Ideal Schedule was quite convenient because it could be used as the staging for the level of care that is different from other scales that usually all measure the severity of disease, but not measure the stage of care. So we validated this instrument and tried to implement the instrument in the residential care. And for the nursing staff, we train them how to do general assessment and how to identify the target problem. We supervise them and we organize the individual meeting to discuss how to identify the targeted problem. And then we discuss how to formulate the care plan. So the caregiving staff could implement the care plan in their residential care. And then within this circle, we could monitor the progress of the program, and also we can monitor the outcome of the individual who have dementia, and also we could monitor the outcome of caregivers in the facilities. And in China, we have developed a practice guideline of how to manage the behavior problems and how to provide quality care for psychosocial support for people living with dementia. We developed a set of quality indicators. So when we support the residential care, we also try to implement this guideline in the residential facilities. And also, in order to support them more conveniently, last year we developed a mobile technology program that on this program they can do assessment and also identify the key problems of whether that's behavior problems or that's nutrition problem or that's the physical conditions. And also we implement the practice guideline in this program. So the care staff can just refer to the key messages, how to manage the people, how to create the dementia care plan. So it is useful, and now we are conducting a trial to evaluate the effectiveness of using this program to support residential care. And also we collaborate with some middle schools. We try to encourage young volunteers to provide certain support for the elderly. Actually, those intergenerational communication was quite constructive, and they were those kind of communities were very friendly between two generations. So we think that this should be sustainable in the future. And during the COVID-19, we used similar strategy and developed a serious document to respond to dementia care during the COVID-19. For example, we developed the free audible and the printed book providing psychosocial support for people living with dementia. And also we developed the expert consensus, the key message flashcards, and also we published our commentary on Lancet. And importantly, we collaborate with the group from WHO and ISIS, so that we try to input our knowledge how to provide support for elderly during this unprecedented times. And also we try to encourage communication between experts and also residential care. And lastly, I would like to update some of the policies relevant to dementia care in China. From my paper published last year in the Journal of Global Health, you can find that we have listed a set of documents on mental health, aging, aged care services. Actually, most of these documents are relevant to dementia care, but that was not too specific. And just this month, our government released the National Dementia Plan. It is under the framework of Healthy China 2030. So this is a national plan. This plan, the goals of this plan was, it was developed by several steps. So within the first 3 years, like from 2020 and to 2022, within those 3 years, we will create a dementia-friendly society to increase dementia literacy, to build a multidisciplinary dementia network, support caregiver capacity building, and then provide support for dementia care and also provide family caregivers, and try to encourage the society to be engaged in dementia prevention. And also within the 3 years, we will try to facilitate routine cognitive screening for people at risk of dementia. So within this first 3 years, all these activities will be conducted in the demonstration sites. The demonstration sites was selected based on our previous national mental health plan. So that means within the mental health plan demonstration sites, we will we will implement the National Dementia Plan and hope for that this dementia plan will be implemented successfully and we can adopt and scale up in more areas. So the key activities within this plan include six categories. That means includes health, education, and promotion, cognitive screening, individualized care and prevention. And also we have to build capacities. That means we have to build multidisciplinary teams, improve service capacity. And also this plan encourage that we have to create data sharing platform. So I'm sure that in the next few years, there will be more and more activities and there will be more and more opportunities to collaborate, not only within our colleagues in China, but also between the collaboration with our international experts. So to summarize, I would say that the continuity of dementia care has been well accepted by the society, and it has a wide coverage, including timely diagnosis, optimal care, and risk reduction. And the community-based care and residential care actually are complementary. They are not exclusive. We hope that these two types of care can provide more support for people living with dementia. And of course, although we have developed and released the National Dementia Plan, but we still think that, of course, it will serve very good support for the full range dementia care. But of course, this policy needs further evaluation of its impact. So we look forward to the collaboration with our international experts. For example, how we could collaborate and to evaluate the impact of our policy and how we could implement it more efficiently and try to scale up in more areas in the future. So thank you very much. That's my sharing. Thank you very much.
Thank you very much, Wally, Professor Wong. So it seems that our topic today, how can we achieve a dementia-friendly society in 10 years, is quite modest compared with the goal of achieving that by 2022. Well, as before, we'll put all the questions towards the end. So may I introduce you our next speaker, Professor Doris Yu from the School of Nursing of Hong Kong U, who will share with us Hong Kong's situation and stakeholders' view on dementia. Thank you, Doris.
Thank you. Thank you, Gloria. Good afternoon and good morning to some of the delegates. So let me share the screen first. In this presentation, I'm talking about the Hong Kong situations and the stakeholders' views on dementia. And actually, this is the findings of the first part of the TIPCAP project. So in this TIPCAP project, we will start with a diagnosis of the situations about dementia in Hong Kong. And then we hope that we can generate the information to inform some of the scenarios so that we can do the cost estimation, and based on that we will also do simulations modeling, and at the end we hope that we can consolidate policy recommendation. So that in this diagnostic phases, what we firstly done is actually we do a rapid as well as an in-depth situation analysis. So we hope that with the data we can apply SWOT analysis to inform how to advance dementia care in Hong Kong. And also we also did a Delphi study in order to generate consensus among various stakeholders' views on the 10 years vision for dementia care in Hong Kong. So in these sections, I'm going to share with you the findings of these two stages of studies. So for the rapid situation analysis, we did a brief desk review as well as using the infographic designs in earlier last year. So the findings basically cover three major areas, including the epidemiological trend of dementia in Hong Kong, the disease burden, as well as the service and initiative to manage the disease. So concerning the figures, I think all of you agree with me that the epidemiology of dementia has been complicated by population aging in Hong Kong, so that the figures continue to rise and it will reach 330,000 in 2039. And according to an earlier study that indicated that 11% diagnostic rate, the burden of dementia is enormous, with the cost of care reached 12 billion in 2010. As 85% of the dementia persons was being cared at the family, it is actually associated with huge societal impact in the society. And as the demographic structures of the Hong Kong populations continue to shift towards older age, these situations will become more challenging in the coming decades. And therefore, the visions both of the Elderly Commission as well as the Food and Health Bureau, they have a common visions to strengthen dementia care service in Hong Kong. And the advocacy was stated in two very important documents, including the Elderly Service Program Plan, as well as the Mental Health Review Report, in which they have stated the strategic directions to guide the dementia service planning in Hong Kong. And for social and healthcare service, actually, the Labor and Welfare Bureau, as well as the Food and Health Bureau, they are the major stakeholders to provide the public service for the dementia. So under the elderly branch of Social Welfare Department, actually is a wide range of care settings. They have offered center-based and home-based dementia care, carer support, as well as respite service to family in need. Besides, the Community Care Service Voucher Scheme also try to enhance the availability of direct dementia care to persons living with that condition. As for the healthcare service, it is mainly provided by hospital authority as well as the Department of Health to cover a wide range of diagnostic, medical, and healthcare service. So over the years, actually, the two bureaus, they take a great step forward to adopt a medical-social collaborations model to enhance the interdisciplinary care provision, care coordination, as well as service integration. And apart from the public sectors, the self-financed and the private service sector also provides daycare unit, residential care places, hospital care, as well as clinic care to supplement the dementia service in Hong Kong. And other than the mainstream service, several new projects and initiatives such as District Health Center Care in Greater Bay Area, Dementia Friends, numerous philanthropy funded project, as well as service operated by the NGO, also develop different strategies in order to enhance the care management for dementia in our city. And it is very important to think of the strategies to sustain such projects as well as to create synergy between different parties in order to optimize the care quality. And another things that we identify is about informal care. So this is actually the unpaid care provided by the family members. So this is the most invisible but most important resources to support dementia care in Hong Kong. And this evidence indicated that the dementia care requires daily 5.8 hours of care and support in activities of daily living. And that is almost equivalent to 70% of effort for a full-time job. So referring to a local study conducted in 2018, actually the unpaid care for dementia is equivalent to 1.8 billion Hong Kong dollars, and this amount will continue to rise to 8.4 billion in Hong Kong in the next fourth decades. However, Hong Kong also have another advantage, that is the borrow strength from the foreign domestic helpers. And actually this is accounted as a paid informal care. And it actually took up around 9.7% of the labor force in the market. And also this workforce actually provides supports to 26 to 54% of families living with dementia. So it is a very important buffer for the caregiver stress, and therefore the social welfare departments, they has rolled out pilot scheme to provide training for the foreign domestic helpers in elderly care. And the extension of these models to dementia care is evolving and need to be expanded. And based on the rapid situation analysis, it provides the foundations for us to develop, for our teams to develop this in-depth situation analysis. So we already developed a test reviews that covers 150 pages. So the next step is we will conduct the SWOT analysis in order to better inform the dementia care in Hong Kong. So that based on the guideline of the SWOT team so that we will identify the factor for strengths. We will identify the factors that stimulate strong dementia care performance. For weakness, we will identify the factors that will increase the dementia care cost and also reduce the care quality. And opportunities, it refers to the new initiative and the area of growth available to dementia care sectors. And as for threats, it is about the factors that will negatively affect dementia care performance. So the work is still in progress, and we hope that we can share with you once the result is available. So I would like to move on to the Delphi so that for this Delphi, we aim at identify the 10 years vision for dementia in Hong Kong from our stakeholders. So it is a 3-phase study, so that in the first phase, we first identify our stakeholders, so that we finally cover 7 stakeholders category, including the policymaker and government sector, the philanthropy organization, academics and researchers, social service provider, health service provider, and also our end user, that is the person with dementia and their family, as well as the general public. And after this phase, we move to the generation phase, so that the aims of this phase is to solicit the viewpoint from the stakeholders about the 10 years visions on dementia care. So we use a qualitative inquiry approach in order to ask them what are the things to make happen for PWD and their families, and also what is the most desirable support for this particular group. And we generate statement from their response, and then we have go to another phase, is the validation phase, so that if we invite the stakeholders again and then let them to endorse the statement that we generated from the qualitative finding. We also check for content adequacy, and any further comments or suggestions on their service was actually encouraged. So we actually conduct 2 waves of data collection. So the first wave is from November 2019 to January 2020. So that in this wave, we actually collect the data through online survey. Because we use online methods, so that we found that for the end users, the PWD and families, the sample actually biased towards those with digital access. That means they will have lower educational level and also milder disease severity. So that's why we determined to collect 1 more wave of data, and we particularly target PWD and carers who don't have digital access. So we use phone surveys in order to generate their view. So here, so that for the online surveys, we call it as a Delphi Study 1. So here is the demographic characteristics of our sample. So in total, we could 19 participants for the generation phase and covers the all 7 sectors. And then in the validation phase, the response rate is 78%, which is very desirable. And then for the second wave, we recruit 100 participants in the generation phase, and the response rate for the validation phase is 83. So you can see that from the family caregivers as well as the PWD, the educational level as well as the dementia disease severity, which is more diverse to cover a more representative sample. So this slide, I would like to summarize the 6 key themes that we identify from the Delphi Study 1. So the first theme is about early prevention, screening, and diagnosis. So the participants highlight the needs for preventive strategies, public education, accessible and equitable screening and diagnostic service, followed by effective referral with a flu-trained service. And another theme is care service and is the care and intervention service, so that one-stop service to address person-centered care need was still mentioned in this category. And the stakeholders highlight the importance of service accessibility, availability, affordability, and specificity, and also the need for aging in place, high-quality advanced care planning, as well as long-term care service. As for capacity building for the care provider and service integration, and the need to strengthen the medical, social, private, public, and wider centers collaborative care is actually advocated by our stakeholders, with effort directed to develop both manpower capacity as well as dementia-specific competency. For family care support is another theme that we identify from the data, and the findings indicated that other than empowering the carers for role fulfillment, it is more important to fulfill the caregiver's need, particularly the psychosocial need as well as the tangible need, in order to sustain these resources. And we also identify themes about dementia care planning and policy setting. So the stakeholders' views also cover importance of having dementia-specific policy and legal framework, and also with evidence-based roadmap, care roadmap, and using shared burden by the society in order to enhance the equitable of the service. And finally, there's also data advocates the importance to increase the preparedness of the society for dementia, so that in these frames, it echoes with shared burden, dementia-friendly neighborhood facilities are being highlighted, and the stakeholders also think that novel research is needed in order to develop evidence-based creative electronic basis and also caring in dementia. And for the result of Delphi study 2, the view is actually of the end user actually merged very well with the stakeholders in phase 1, and it also adds specificity to the finding. So for example, this is the 6 themes that we identify in phase 1. We found that for capacity buildings as well as dementia care planning, the end user highlights the importance to enhance the service coordinations and the long-term care planning, with the specific emphasis on strengthened case management, enables continuity of care. What they highlight is person-centered, but also family-based long-term care, and use research to enhance the evidence-based service provision. And then for increased preparedness for society for dementia, they also emphasize it is so important to optimize the normality of living with dementia. So I think this is the point that we keep on identifying from the recent TIPCAT activities. So they also emphasize the need for dementia-specific facilities and also suitable housing, and service equitability is also some things that they highlight. And as for care interventions and family care support, the end user describes the more desirable version for a wide range of care service, from center-based, home-based to residential care. Again, what they wish is dementia-specific service with more option, and then comprehensive care to enhance continuity of care, home-specific and equitable service for those deprived group, and also more comprehensive and holistic caregiver support. So after that, the statements we generated for each theme was sent to the informant for validation and seek their consensus rating. So the rating is very satisfactory for phase 1 as well as for phase 2. So that based on the situation analysis as well as the Delphi, we generate 6 perspectives as well as quite numbers of milestones in order to facilitate our subsequent step, that is a co-designing process for an evidence-based informed dementia plan. So Gloria is going to give us a presentations on this very important step. So thank you.
Thank you very much, Doris. So I think but the part of my sharing would be related to Doris, so maybe I would just move straightly into my part. If I could share my screen. So the topic that I would like to share with you today is about the next step for Hong Kong. How can we co-design an evidence-informed dementia plan? So I will burden you with all these. This is a map that is taken from last year's World Alzheimer's report, and it's showing you globally where the countries and territories with a national plan and the areas with a plan in development. And since its publication last year, actually we have just heard earlier today that China has already got a national dementia policy. But what about in Hong Kong? What are we doing? So actually it's what TIPCAT is aiming to do. So we want to have a plan that is co-designed. You may ask, if this is such an urgent task, why do we bother to co-design? So just very quickly, some of the background of our ideas of developing a plan with all different stakeholders. So as we all know, dementia care and prevention involved, and also impact on multiple sectors. So in the development, we think that we will need more than just experts and policymakers. So it's nothing without us, nothing about us without us. And I always say that dementia is one of the great equalizers, because you will be impacted either directly or indirectly as a carer. So anyone can be affected. So and that's why there's good chance that we have a common goal that we can achieve a common goal. And exactly because the task is urgent, actually we do not have time for trial and error. So that's why we want to make sure that we get everyone's brain into the task in designing, and also we want to use data to inform whether our plan is feasible or not. And also one thing that whenever I talk to people in the field, we always heard that one of the difficulty in Hong Kong is, despite all the wealth we have, despite so much input, the progress seems to be quite slow. So we're thinking, what's going wrong that we have not yet made a difference in people's life? And I think this is the key to it. As we say, that a policy without a strategic plan remains a dream, and a plan without policy is aimless and disorganized list of activities. So in the TIPCAP project, we want to combine our dreams with a plan that is actionable. And the way we are doing this is through a fear of change method, which Martin already mentioned. So basically, it's an outcome-based approach, which describe how we bring about specific outcome through a logical sequence of intermediate outcomes. And what we are trying to do in Hong Kong is to develop a plan through this co-designing process, and also to feed in data and use modeling method to see whether this plan can be implemented and how would be the best way to implement it. And in this project of co-designing a plan, we are very lucky that we have involved 33 representatives from multiple sectors. So family carers, general public, we have both healthcare sectors and social sectors. We have government bodies and also self-financing and private partners, and also from, representatives from academic and also philanthropies. And actually, Doris, myself and Terry are the facilitators of the meeting, and we have actually just finished the second meeting last week. And today I'm very happy to share some very preliminary observations with you. And apart from the meetings, actually we also communicate with all the representatives through on paper and through other communication methods. So what happened during those meetings and also during our communication? The idea of our workshop is not to dictate what Hong Kong needs, but based on what Doris have already shared with you, what our stakeholders told us, that there are things that they want to see in the real world. There are impact that they want to achieve, and also there are other outcomes that they want to see within 10 years. So the group, this 30-something people, our goal, our duty is to try to work out a map like this to go to this target, the ultimate outcome or impact where we want to go. And in the process, we discuss the evidence, we discuss whether it is the logical steps, and we discuss what need to be in place, what are the interventions and what are the activities that we'll need to do to be able to achieve the ultimate impact. Now, very quickly, I will move on to some of the discussion results that we have. So where do we want to get to in 10 years? Now, one thing that come out clear and loud is that a clear goal is that we want to turn Hong Kong into a dementia-friendly city. And by that, we mean that people living with dementia and the carers, they can lead normal life and they can age in their own home with dignity, with meaning of life, and also with good quality of life. Now, this is very clear. And another interesting thing is, as both Huali and Martin touched on, is as we discussed, another theme that emerged is that we think that we want to achieve not just that. We think that we may also be able to reduce or at least slow down the increase in the number of people living with dementia through effective prevention strategy. Now, whether this can be something achievable in 10 years, we we'll have to see with the data, and our friends from LSE would be able to tell us more about the modeling findings that they had with projection of reducing the risk and how that is going to affect prevalence. Now, with that said, at least the important thing is that we set that as a goal, and then we can think about what are the actions that we need to carry out to be able to perhaps achieve that. So very quickly, sharing with you how do we get there in 10 years according to our discussion. I'm going to show you a very busy map. So this is a roadmap in progress. I am sure that you can't see what is in here, but the idea is that during the discussion, we realized that actually a lot of components are interdependent. So one outcome achieved in a sector would affect another sector. I would just want to very quickly summarize some of the key ideas that came out from the discussion. So we discussed several areas. So in the housing and environment area, we think that we want to achieve dementia-friendly housing in 10 years' time. And we think in the intermediate, in the medium term, we will need to pilot the program and perhaps develop a guideline for that. And also for the policy and philanthropy sector, we think that the carer-friendly employment practice is important. And in the public sector, we think that we need a life course approach in education and starting from young age. And in the social and healthcare sector, we want to see a clear triage and care path so that we can improve system efficiency. And also we want to see a one-stop locality-based collaborative care. And which involve the neighborhood and the wider sector engagement. And finally, for families living with dementia, we think that the goal would be, the intermediate goal would be not just empowerment and training, but also providing them respite that would be easily accessible to them. Now, this is still very much a work in progress, but I want to mention that the housing and environment idea actually coincide well with the World Alzheimer's report released just today, the topic of which is about design and dignity and dementia and the built environment and how that is going to help people with dementia. So that's something we want to work on in the next few years. And this is very much a work in progress. And after today's sharing, I'm sure the group will still have a lot of discussion. And I would want to invite every one of you to join us in providing us ideas and telling us what are the steps that we'll need to be able to achieve the target in 10 years. So with that, I want to stop here because I want to save some time for our discussion. And before I end, I want to thank a team from from Hong Kong U and also from LSE and Hong Kong Alzheimer's Disease Association and Peking University, as well as our staff members at Hong Kong U. So thank you very much. So I think next I would like to invite all of our speakers as well as a few other friends who I haven't got the chance to introduce. So Ms. Adelina Comas Herrera, hope I pronounced your surname correctly, from the London School of Economics and Political Science, and Dr. David Dai from the Hong Kong Alzheimer's Disease Association. And for this part, I will pass the time to Terry to chair.
Hello, everyone. So we have a very intensive 1 hour and 50 minutes already. So I think you may have a lot of questions. So I think the most kind of pressing question is, okay, we have a roadmap, we have some idea, both in the China national plan as well as in Hong Kong. What we want to do, and the Alzheimer's disease in the national report, is to build a dementia-friendly community or estate, or or village. So you can take it, but although we have a roadmap, how are we going to reach that objective in the next few years, right? So I think this is a kind of $1 million question we are facing. But before we start the discussion, let me first, kind of introduce the panel we have right now. So we have Dr. David Dai from the Hong Kong Alzheimer Disease Association, who just, who do not have chance to talk, to share his idea in the last hour. And then we also have Adelina, also, very patiently waiting here. So why don't I give each of them, 2 or 3 minutes, a few minutes to talk about their feedback on the idea we just said about. So how are we going to build a dementia-friendly city in Hong Kong, in China, or all over the world? So why don't we start with our guest? So Adelina, your turn first. So a couple of minutes. So what is your take on this question?
So it's been amazing to have the privilege to work with you and to learn a bit about everything that you already have in place in Hong Kong, and then about the aspirations that people are expressing about where they'd like to be. And I have to say, it's in these difficult times because of COVID, it is actually an extremely wonderful opportunity to work with you and to see so much thinking and so much bringing together of perspectives to build something better. I'd just like to maybe emphasize the complexity of dementia care systems and the fact that there's so many different elements that take part. And we spent some time in England trying to build the map of what would be a dementia care pathway. And that started from the first moment when people have some concerns about their memory potentially to end of life. And we try to map all the different agencies and types of services and all the different steps that people had to follow to be able to access one service after the other if they were lucky. And identifying the barriers in those systems was very revealing. It's telling us that a lot of the things that we worry about or that are problems are actually systemic. So when I was thinking, for example, of Hong Kong, whether, it seems like an important issue for you is the diagnostic rate. And then it's thinking, why is it so low? And why are so few people going, from perhaps speaking to their primary care doctor to actually getting to have a diagnostic? Why are they not speaking to their primary care doctor about their concerns? What is the issue here? And I think it's really, this work you're doing is absolutely fundamental to understand all these different steps and all these potential barriers, but also where the solutions might be. The solutions might be dementia specific, but they may not. So it might be that some of the issues are more to do with what's the relationship between your primary care and your specialist services, and then how that translates to people accessing the dementia care pathway. Maybe that you can build on this amazing network of dementia community services that you already have to kind of compensate a bit for this lack of access to primary care potentially. So you have so many opportunities, and just wanted to congratulate you and thank you again for involving me today and in the project more generally. Thank you.
Thank you, Adelina. So Dr. Dai, so what is your kind of feedback on what we have presented, in the last hour? And you haven't unmuted yourself yet, Dr. Dai. You still haven't unmuted yourself. Okay.
Can you hear me? Thank you very much, Jerry. And I also want to thank all the speakers for the wonderful presentation. And we should start with referring to Martin's talk. I think what I gathered from him is that it's important to map out some changes. Now, it looks like in Hong Kong we have everything. Thanks to congratulations from Alina. We might have a lot of things, everything, but it looks like we have a lot of activities. But what we lack is some top-down organization and coordination. And if time given, perhaps we can go further into that. So some of the changes which will bring about changes towards dementia-friendly community. Now, I want to thank Huali also for highlighting the dementia, national dementia planning in Greater China. After all, we are part of China now. And she pointed out the opportunities because of this national plan that might occur in China and also in different regions. And I want to take this opportunity perhaps during our discussion, we can explore into ways how Hong Kong can be integrated into Great Bay Area, and how some of the services and some of the policies can be compliant both ways, in particularly in the area of elder and dementia care. Now, Doris has mapped out a very comprehensive picture. She mentioned about the importance of medical and social care, and also the importance of task shifting, so that medical care can be complemented with social care. But what we see now, it's only task shifting, meaning that secondary care shifts some of their burden and work to primary care. But what I think in future we should empower and educate our primary care, especially in medical, to take up more work in primary diagnosis for simple and complicated cases, so that the waiting time for making a diagnosis would be shortened. I think this is very important. Gloria has talked about some steps and maybe timeline, but this is exactly what we need. A top-down strategy is important, and what I suggest is that we need the government to set up a on high level, policy level, a dementia office, to make things happen. And Hong Kong is not big. We have 18 districts, and and every district is different in its composition of population. So what I suggest is that a district-based coordination of services to meet the needs of persons with dementia and their families in both medical and social terms are important. These are my very initial feedback on the talk today.
Okay, thank you, Dr. Dai. Okay, we still have about 40 minutes. So let us focus, we can spend all the time, on the potential challenges or problem, right? But I think it will be much more productive if we focus on the potential solution. And I'm aware that, the slide that Professor Wong shared on the national dementia plan, one objective is to create a dementia-friendly society by 2022. So it is only about 2 years from now. If we are using Hong Kong's step, it will be lucky if we can start the process, by 2022. But in Beijing, they are talking about create dementia-friendly society by 2022. So it will be kind of impossible task for us. So may I invite Professor Wong to share a little bit on the step that Beijing is going to implement, to make it happen in the next a few years. So Professor Wong, please.
Yeah, thank you. Thank you, Terry. And also, actually, I think that David just mentioned that it would be a good example if we can try to implement the plan in the Great Bay Area that could be collaborate with Hong Kong and Macau. That's a good example. I mean, it might be a good example in the future. And regarding the creating the dementia-friendly society, that means we're trying to make it's not an ultimate goal. It's try to create the social atmosphere that people could accept dementia and also could understand the dementia, and then try to provide support for people, like going around in the street, in the neighborhood, and trying to provide timely support once they notice people who might need help. So it is not a comprehensive, I don't think that we could reach the ultimate goal to make the society more friendly, but it will be a great progress from now. Actually, before this plan was initiated, we already did a lot of campaigns in the society. For example, in 2012, the CCTV launched the program that trying to educate the public about how we could understand people living with dementia and what we could support. For example, Yellow Wristband project that's the signal of paying attention to people living with dementia. And also in the past nearly 10 years, we have made a lot of progress. Especially this year, we can notice that when the plan was announced 10 days ago, and just within this past weeks, we noticed that there are a lot of public educations on dementia, and people started to talk about dementia everywhere. So we could foresee that in the future, people will accept this situation, accept this population much more readily than before. So, and within these 3 years, we don't think that it is going to be like in the whole China, but we will do that in the demonstration area. So trying to educate the society from zero to something there is. So yeah, trying to do that.
Okay, thank you, Professor Wang. So I'm also aware that when we talk about dementia-friendly society, a lot of time we focus on the software side. So as I say, education, literacy, right? But Dr. Lam mentioned a kind of the importance of environment. And then both Beijing, London, and Hong Kong, we are facing the fact that we are old city. We have a lot of old buildings, and we are not going to bulldoze the development. We are not going to destroy the old neighborhood, and we build a quote-unquote modern and dementia-ready or dementia-friendly society. So how are we going to retrofit, the dementia friendliness into an old city like Beijing, Hong Kong, or London? So let me first throw the question to Dr. Lam. It is a topic we talk a lot in the 3 Way of Change workshop. So Dr. Lam, if you are kind of a government, say, I give you a blank check. However, you cannot just destroy everything, right? So how are you going to test the concept of dementia-friendly city or society in Hong Kong?
If we are talking about the infrastructure, the city infrastructures, it's a very much we need is a paradigm shift in shaping our society, especially in a metropolitan city like Hong Kong, and maybe New York and London too. And while we are planning our urban area, we are talking about the vertical city, and we put a lot of emphasis on convenience, efficiency. And I would say most of these modern city planning concepts are contradictory to the concept of dementia-friendly. And talking about Hong Kong, I think the first thing we need to do is to educate the policymakers and also a lot of town planners, builders, contractors, developers. And as I just mentioned in the opening remark, and the major problem may not be in the public sector, since to our friends in UK, you may not know that more than half of our population are living in various kind of public housings. So relatively they are more okay, because the government adopt at least barrier-free universal design, or even with the modern estates, we put in the dementia-friendly concepts in the estates. But we have more problem in the another half, is the private developers. So their main emphasis are just build a beautiful apartments and then sell them in a high price. And so we need to do a lot of advocacy and education among this sector of people. And I would say it is doable. before a few years ago, no one from our sector having dialogue with urban planner, architects, and so forth. But throughout the past few years, and I myself personally engaged with a lot of housing people, planning people, and actually they're willing to listen. And I would say most of them are having zero knowledge, not to mention dementia, people with dementia, even zero knowledge on an aging population, how to build for an aging population. They don't have entirely no idea at all. Because most of our modern cities are built for, as I just mentioned, for economic growth, for efficiency, especially in Hong Kong, for convenience. And we are so successful. And in this kind of city design. But now I think we need to rethink and unwire all the philosophy principles and then go to the menus, guidelines, building guidelines, all these kind of things. So if we are talking about the building a dementia-friendly infrastructure, I think we should reach out to this group of people.
So Dr. Lam, how likely do you think, for example, before 2022, right, the deadline set by the China's plan, we could pilot, for example, in a certain area, private housing estate, public housing estate, pilot a couple of, dementia-friendly estates in Hong Kong?
I think it is workable. It is workable. And we have an NGO in Hong Kong called Housing Society, who is very, very sympathetic towards aging and dementia. And actually, they are the only building housing body who developed senior housing and who make a commitment to develop all estate with aging in place concept in mind. And so I think it's not difficult. I personally involved in that housing society, and I think if we just put one or two of the estates to develop into a kind of dementia-friendly estate, I think it is workable, and we can do a pre-intervention study and a post-intervention. And one very good indicator is the mobility of those people with dementia. Say since in most of their estate, around 30 to 40 or even some up to 40-something% of the population are elderly people. And I believe there are many dementia elderly living in one single estate. And so we just study their behavior before the intervention, and then we put in the intervention by training, by some retrofit, and put in some programs and so forth, and then we study, and to see whether we can really facilitate our people with dementia to go out from their locked apartments, and so that they can enjoy shopping in the supermarket and not being embarrassed, and they are welcomed to the park, and they can go do whatever they like within a very safe environment in the estate. I'm not talking about going to elsewhere, and we just limit to an estate. And for our overseas speakers, some of our estates are actually quite big. It's just like a small town in UK, and housing maybe 12,000 or 20,000 people in one estate. So that's the county already. And so if we can make it into a dementia-friendly estate, it will be a very good demonstration. Without talking about the private developments, if all the public estates are doing the same thing, we have half of the population will enjoy a dementia-friendly living environment. And since more elderly people are living in these public estates. That means maybe we have 60 or 70% of our older population are already living in a dementia-friendly environment.
Okay, thank you, Dr. Lam. So how about our friend from London? So how far London is from the target of being a dementia-friendly city? What do you think London need to take to make, or it need to take to make London a dementia-friendly city? So either Adelina or Martin, or both.
And I can chip in with something. I'll say two things, one about Hong Kong firstly, and one about UK. I think that what we need to remember is people living with dementia have many other health conditions. I mean, on average, they have 3 other health conditions. They're often quite frail physically. And one of the things I love going to Hong Kong, one of the things I particularly enjoy is bus journeys in Hong Kong. Your bus drivers are like Grand Prix drivers. They drive at the very, very fast. And I always worry about older people, frail older people. How do they cope on public transport when drivers are going around corners in the way that they are? So I would say that a dementia-friendly city is multidimensional. It's not just about health and care. It's very much about design. And I think Dr. Lam has got it exactly right. But it's also about transport and shops and everything else. So I think we need to make sure we do that. I don't think London is doing terribly well. There are parts of London that are okay. And I think local authorities that manage the community environment are aware of people with dementia, much more aware than they used to be. But I think as some speakers said earlier, these are old cities. Hong Kong and London are old cities and old designs, and that can be quite challenging. I think what is changing positively, and I will be quiet after this, is in terms of the health and care systems, that health systems in the UK have to be much more dementia aware. Hospitals have dementia champions and so on. So there's much greater attention being paid there to make it a dementia-friendly response in our community.
Thank you. Adelina, any supplement?
It was one thing that struck me very much when I visited Hong Kong was to see how well you use the parks and how well you use the rooftops and how much imagination has gone into already using these spaces that to me looked so challenging in ways that I wouldn't have necessarily have expected. And I do think that other cities can learn from that. And as Martin said, London is it's a very different kind of city. It's very spread out. There's actually not that many people who live in the center, and it's much more suburban in its design. And then you have basically multiple cities with like, in a bigger scale than you do in Hong Kong. But I'd like to stress the importance of taking this and as Martin said, taking this very broad approach to what is to be dementia friendly and to look at all the aspects in which cities can create barriers.
Okay, thank you. We have some questions from the participants. So one question I want to raise here, a anonymous attendee said, apart from more active screening of dementia and more collaboration with different sectors to achieve a one-stop care platform, what roles can healthcare workers specifically play to build a more dementia-friendly society? So what role, healthcare workers can play to help build a more dementia-friendly society? Maybe Dr. Dai, you want to take this one first?
I mentioned, yes, hello?
Yep.
I mentioned a bit about primary care. I think what we need is engaging our primary care in early diagnosis and early intervention, and then we can create a district-based medical social collaboration so that the patients having been diagnosed will receive continued social support. Post-discharge support is very important. And then when our frail elders with dementia, they go into hospital, I think this is an area which because I come from a hospital background, I think there's a lot to be done for the person with dementia admitted to hospitals for whatever reasons, hip fractures or pneumonia or other reasons. With a diagnosis of dementia, usually the care afforded sometimes may need, patients with dementia, we need even more care. So dementia-friendly hospitalization, and not only the environment, but dementia-friendly hospitalization experience, I think this is important. And then today we don't have a lot of opportunities to talk about residential care. Now, what is unique to Hong Kong among these areas that we have a high institutionalization rate? Let's not criticize it, but over 50% of our residential clients have dementia, and many of them have very severe behavioral and psychological symptoms. So I think this is an area which healthcare workers, a nurse-led team to coordinate the management of BPSD in residential homes in Hong Kong. I think that is important. And education in this area is very important too, because there are studies to tell us that it's not educating our administrators only, but also educating and training our very frontline healthcare workers, not professionals, but healthcare workers in the management of BPSDs in residential homes.
Thank you, Dr. Dai. So let me ask other, panel here. Do you have any other final comment regarding, the role of? Okay, Adelina.
Yeah, so I think we have an opportunity to think. I mean, the WHO is now moving towards the decade of healthy aging, and we have all this drive on how to support people in aging well and making the most of the capacities that they have. And I think it's really, really important that we make sure that spotting the risks of dementia and early and helping people address them, and also identifying people who have dementia in a timely way, needs to be an essential part of healthy aging, because you can age better with dementia, even if we can't at this stage get rid of it. Having dementia doesn't mean that you immediately have to have all the worst outcomes. We can do a lot to help people with dementia progress less quickly or have less problems with other health conditions. So we need to make sure that we embed our thinking, our understanding, and our learning that we've been acquiring all these years on dementia into these wider healthy aging policies. And I think that's an opportunity that we need to be mindful of, as I expect countries hopefully will also be looking at these wider WHO policies on healthy aging.
Well, I think it's a very good, Doris. You need to unmute yourself, Doris.
So just a very quick comment, because recently I'm testing a models using in a JC project, so that the nurse as a case manager, but this time we are not using other frontline worker, we use volunteer, so that we found that if we want to say capacity building, it is always very important to how to sometimes we never think that they can grasp the professional knowledge, they can make decisions in the care planning, but our experience in the past 2 years, we think that it is totally feasible. So that in terms of capacity building, I think healthcare workers actually play a role in this in this particular area. And another thing is another research is doing self-care enhancement, but I think the speakers is actually, they raise a very important problems. Actually, dementia patients always has multi-morbidity. So that when we're doing the self-care empowerment, we always ignore the cognitive function and how to tailor the education plan in order to fit the need of dementia patient. So I think this is something very important to make sure that it is an important element in a dementia-friendly environment.
Okay, Professor Wang, you need to unmute yourself first.
Yeah, thank you. I just want to add one comment about how to make the health workers to be friendly, to be involved in dementia-friendly community build. Like in big cities, we all faced with the challenge of transportation. As Martin just mentioned, that when the elderly try to transport to the hospitals and medical facilities, they have great challenge. They feel difficulty to get a taxi. They might difficulty to get on buses, even when they have to run in rush hour. So in our dementia plan, actually we encourage the professionals and the specialists to move down to the communities. That means we make the professionals to be mobile. That can help us to increase the coverage of the service, the people who could receive help. And also that can reduce the burden of transportation and reduce the burden of frequent running between community and hospitals. So that I think that this is one of the innovation in our plan. We try to make the professionals to be mobile so that they can travel to the communities. Yeah.
Very good. Thank you. So I think we overrun for about 15 minutes. So I apologize for this one. But I want to kind of, before I pass the microphone back to Gloria, I want to kind of highlight this one. So Adelina mentioned, we should not just view or see, dementia-friendly as an isolated topic in the society. So it should be integrated as a strategy for promoting healthy aging, in the society. And according to the new WHO definition, healthy aging is not free from disease or illnesses, right? So it is on how to maintain functional capacity so that the older people can to be and to do what they have have a value to do, right? So I think that is extremely important. Regardless of dementia, cognitive impairment, older people should be empowered, by the environment, as well as healthcare sector, everything, to be and to do what they have a value, to do so what they want to do. So let me end this session, right now, and I want to say thank you for all the panelists, to share your idea. Let me pass the microphone back to Gloria for the final words, for this symposium.
Yeah, thank you very much, Terry and everyone. I just want to very quickly say a big thank you to everyone. And I noticed that in the Q&A box, actually there are a few other very important questions. Just want to make a final remark that it's not common that we see in other fields that everyone is so enthusiastic and trying to work together no matter what kind of background they are from. So I feel very hopeful after today and also after our Theory of Change workshop and also the Delphi study. So we promoted this symposium rather last minute, and then within days we have over 300 people registered, and today at the peak we have more than 250 people joining us. And with this enthusiasm, I think we will be able to see some real changes, and I hope that we can bring back the news to everyone next year at the World Alzheimer's Day. So thank you very much, everyone, and see you soon.
Thank you, everyone. Bye-bye.
Bye.
Bye.